Hi guys, this is a video about getting dental treatments such as composite bonding and veneers in places like Turkey versus here in Ireland. We also talk about digital smile design. This is with the lovely Dr. Barry. So loads to unpack and sink your teeth into. Please sit back, relax, enjoy, and happy watching.
What is a digital smile design?
Digital smile design is where we use a piece of software to design a person's smile. We take a scan of the teeth as they look now, and then the software allows us to build up those teeth into the ideal shape and proportion to each other, and we combine that with photography. Actually, we take pictures of people's face and we can fit a new ideal smile into that person's face. And then, as well as, I suppose, improve the smile, we can plan for a new bite, plan for different types of restorations or different types of materials, and then we can take a copy of that design and actually try it out in a person's mouth. So with temporary material, you can use a blueprint and put it onto your teeth and actually feel and see how it looks before we move on with any treatment. So it's a great way of like planning first, but also again guiding your final treatment. The person gets an opportunity to look at the actual design and the picture of themselves, or actually feel it and take pictures of it, and they can make tweaks based on that design. So they can kind of go, I'm not sure I like the length or the shape of the teeth, and we can kind of tweak that design to suit the person before we go ahead with treatment. So it's a great way of getting like the person's input basically on what we want the final result to look like. Otherwise, you're kind of plucking it out of thin air what you hope it's going to look like in the end. But if we can design exactly what would suit the person and they can see it on themselves before you get to the end of the treatment, it makes it all predictable. You know what you're going to look like at the end before we start any sort of treatment, or before they even invest in the full treatment. They know what it's like.
Why do you like using digital smile design for your patients?
It allows us to plan out the best smile for that patient, to kind of take in all the factors, basically the condition of the teeth, the position of the teeth, and design what's the best fit of smile for their mouth and for their face. So we can use that then to try in with the patient first of all, so they can actually take a model of that and we put it over their teeth, and they can actually look in the mirror and see what the ultimate result will look like and get a feel for it as well, because the teeth will be a different size, the bite will feel slightly different as well, and then we can tweak it based on what they like or don't like, about that smile design. And then actually we can use that design to help us to do the treatment as well as our blueprint for the final result. So you use that when we're planning or preparing for a restoration.
Have you ever had a thing where you kind of look at someone and think, I think you need A, and then you do the smile design, you're like, actually it looks like you might need B?
The beauty of it is that you can actually try something out that you think will look ideal, and then you try it in and actually it's a bit too long or a bit too bulky, or we can check how they can speak with this. Can they speak properly with the new length of the teeth or whatever it might be? So it's a great way of pre-planning and changing then if we need to. And then if you do change that design, you can rescan your new design and use that as your final result, knowing what the result will look like before you pick up a drill and start working on the teeth.
How does someone look after their composite veneers?
So there's a couple of different things that you need to look at. So the first is just having good oral hygiene. So brushing twice a day is normal. Cleaning between the teeth with your floss, TP brushes to kind of keep the gum nice and healthy. It can help kind of reduce the amount of staining that you get on them. The other thing is to be careful with your diet, particularly bonding on the front teeth. It's in kind of thinner sections, so we need to be careful with biting on anything that's kind of hard or chewy. So I suppose avoiding foods like that, or an apple, for instance, cutting it up and chewing rather than biting straight into it, that sort of thing. Crusty bread can be not a great one for it. Chewy sweets, but you should avoid those anyway. And then the other thing is to wear a night guard. A lot of people grind their teeth, and that's mostly happens at night, and that can be destructive for your bonding.
And if someone hypothetically bit their nails a lot,
they should stop. There's that thing you can get, the like...
it's rank.
Yeah.
So bad. But it doesn't just get on your nails. This is the thing. It gets on your hands, and then if you eat something, you're like...
Yeah.
No, it's the worst. But I've actually found, I've been getting Invisalign done, that it's actually really helped with biting my nails, because I can't bite them when I have the aligners in. So it's almost kind of like, it's like getting me ready for the bonding.
Yeah, it's stopping the habit before you even... Yeah, that's actually a good idea. Maybe we should start getting people to wear retainers during the day afterwards to stop the nail biting habit. We've come up with a new dental treatment.
Oh my God.
Yes.
Trademark Emily Rudden. What role does photography play in cosmetic dentistry?
It's very important in cosmetic dentistry. We take a kind of a whole series of photos before we start, so we can kind of show the patient on a big screen what we're looking at. It makes it easier for us to explain what we're seeing, and also the photograph will bring up a lot of detail that we can't always kind of see with looking directly, and kind of gives you a big overall picture rather than looking at one tooth individually. And then it helps us to kind of plan what we want to do, so we can kind of look at the details of the smile on the photograph, the proportions of the teeth teeth versus each other, the smile line, the width of the smile, and point that out to the patient, kind of talk through what the goals would be, and then we can use that to communicate with the lab. The photograph gives them lots of information that they can kind of build on. With the digital smile design, you can actually imprint that smile over the photograph that you've taken as well. And also then you kind of may look at the photographs before and after and make some adjustments on your final treatment based on how things looked before. If there's certain features of the teeth before you started that you want to kind of keep in the final result, certain kind of outlines or shapes, you can actually use your before photograph to kind of guide your treatment as well.
What's the difference between turkey teeth and what you do?
The trouble often is people are told they're getting veneers, but they're not, they're crowns, and sometimes that is necessary, but we try and avoid that. Definitely for purely aesthetic reasons, we try and avoid that. Especially people who are so young, they mightn't have any fillings in the teeth even, never mind, so the tooth is perfectly healthy and then it's shaved down just to make it kind of look nicer, when there's so many ways you can just add on material to improve the shape or position without taking any part of the tooth away. And I suppose people don't really know, they mightn't be warned about the fact that that tooth might end up needing a root canal treatment. Or if you're making these crowns that are kind of like a stock size and shape of crown, it's not going to fit in with the rest of their mouth. Their gum health will suffer, you won't be able to clean around it that well. It should be designed that it fits your gums and fits to the rest of your teeth so that it looks right, and also that you can kind of clean around it properly. That's what we're trying to do with the price matching cosmetic treatments in Turkey, is that we don't want people going over there and trimming down all their teeth and ending up with all these problems that then have to be solved. That's obviously much more difficult for the patient, but it's much more difficult to try and solve that problem than do something more minimally invasive, bonding or veneers or whatever it might be. You know, we don't have that much tooth left from the first time round, so it's much tougher. You get to your result quicker, but you end up needing a lot more treatment.
It really seems like just making such a mountain out of a molehill.
Exactly. So that's the goal of price matching, is to offer not necessarily the exact same treatment plan, because most young people don't need 24 crowns. They just want a nicer smile. So the goal is to try and meet that person's goal of a nicer smile for a price that they have been quoted, but a more minimally invasive.
I sent a picture of my teeth to Turkey Clinic, pure curiosity, just to see what they said. And they came back with 20 crowns. I've never even had filling. Like, the fact that they want to treat your molars is just wild to me.
Yeah, and even your premolars, the idea, I suppose, is that they mightn't be charging as much per tooth, so therefore they have to include as many teeth as possible. And often it's teeth that don't need to be treated. The idea of what we're trying to do is to make an appropriate treatment plan for the person that mightn't necessarily include all those teeth. Sometimes it might, but not to put crowns on necessarily all of those teeth for a price that's kind of suitable. You know, and it's to avoid kind of young people filing down back teeth that don't need to be done and then having to have treatment over and over again to solve all those problems, which ends up costing way more than it would have initially if we had more conservative kind of option and just planned it out well beforehand, rather than going straight into just crowns on everything. It just doesn't make sense.
Is 3D printing used in dentistry?
Yes, yeah. We use it to make our temporary crowns and veneers. So we can use that to print an exact copy of what we had planned to do for the patient to kind of fit over the tooth that we've prepared for the crown or veneer. It kind of gives a better final result, especially if a person is going to be in the temporaries for a while. So sometimes we put temporaries on for a longer period of time, so the person kind of gets time to get used to their new smile or their new kind of bite. So the printed ones will look better and they're harder wearing, so they last a lot longer. They're kind of nicer to the gums and the soft tissues as well. So yeah, it's just kind of another way of utilizing technology to give a better result.
If a patient wanted to move from composite veneers to ceramic veneers, what's involved there?
Often I will advise patients nearly to try out composite veneers before going to porcelain veneers, even if that's only for a testing out period. And that's because it gives you time to get used to a new smile, a new shape, and it's less destructive than porcelain veneers. Not that the porcelain veneers nowadays, we can do quite minimally preparations on the teeth, but it's still irreversible, whereas your bonding, you can polish that off again. But so if we were then progressing, that's how we would do it. We would polish back to the natural tooth first of all. If the patient was happy with their bonding beforehand, we can use that bonding as a blueprint for how we will get our porcelain veneers to look at the end. But basically, yeah, we polish back to the natural tooth. If we need to do some preparation of the tooth, then we would do that next before putting on our porcelain veneers, because we need a certain amount of space for the thickness of the porcelain. But in a lot of cases, that can be very minimal, the amounts that you need to repair. It can just be a tiny amount at the finish line, so we know exactly where the veneer is going to fit on the tooth.
And what are the reasons that you find that people normally want to go from composite to?
The main reasons are that the porcelain veneers will last longer, they're harder wearing, and they're more stain resistant, and they can give a better final aesthetic result. They kind of have a shine that they keep that the composite veneers don't. They can kind of dull a little bit over time, so they need a bit more maintenance. You do need a yearly kind of review of them to polish them up remove any staining. If there's chips or wear, that you can repair that. That's the advantage, I suppose, of the composite, is that you can repair it, whereas porcelain veneers are not as easy to repair. They're trickier, and if they break, you kind of need to replace the whole thing. But you're less likely to get there as quickly. They will last longer than your composite bonding.
Interessante. Why would a patient need a crown after a root canal?
The reason a person needs a restoration like that after a root canal treatment is normally like there has been a big cavity or a big filling before, or part of the tooth has been cracked, or something has caused the tooth to need a root canal treatment. So it's already missing part of the tooth. And then to do the root canal treatment, you need to get into the pulp of the tooth, which means you need to make a hole in the middle of the tooth. So you're basically just left with a shell of the tooth around the outside afterwards. And this is prone to breaking. So the idea of the crown is that it's kind of a hat basically over the whole tooth that kind of binds it together. But actually nowadays we're kind of moving towards more minimally invasive options after root canal treatments.
Oh, really?
Yeah, so a crown, it does mean you need to take away a lot of tooth, and the tooth is already vulnerable. So with a crown, you have to take away the outside of the tooth as well as the top. So you have less tooth. It does still protect it and reduces the risk of a fracture, but you are taking a lot of tooth away to do that. Nowadays, you can do a treatment called an onlay, which is like a partial crown. It covers kind of the top of the tooth over the cusps or whatever part of the tooth that's missing, and it does the same job. It bonds to the tooth, which reinforces it, and it stops the forces pushing shell apart, but it's more minimally invasive, so we don't take as much tooth away. And if that fails in the future, like an onlay or a crown, at some point will need to be replaced. With the onlay, if it fails, usually it's failure between the onlay and the tooth, so you still have tooth left. Whereas with a crown, it can take more of the tooth away with it because it's quite thin, so you're less likely to be able to restore that tooth again. Whereas the onlay is more minimally invasive, so it's just a nice way of treating.
Major news, we are price matching crowns and veneers. Tell me about it.
Yes, so we're price matching Turkey cosmetic treatment plans with Irish quality. So we're taking a treatment plan that often is like a little bit too aggressive and offering a cosmetic treatment plan that's maybe a bit more appropriate, a little bit more minimally invasive for that same price. The idea is to try and avoid people getting over treatment or getting teeth filed down that don't need to be filed down when something way more minimally invasive can be done. And oftentimes it's going to cost the patient a lot less in the long run, because teeth that are filed down often need more and more treatment in the future because they run into problems with root canal treatments or gum problems or losing teeth. So you're going to end up paying again and again and again, whereas we're trying to offer an affordable treatment for people that isn't going to be so aggressive and cause lots of trouble with their teeth in the future. And also using modern technology to design and plan those treatments beforehand, so a person has an idea what it's going to look like before they even start.
They're not going in blind.
They're not going in blind. Generally, people want a nicer smile. Is what they're looking for. They're not looking for 24 crowns. So we're trying to achieve that goal of a nicer smile by using other types of treatment options that's not just crowns everywhere, and matching that to the price, so people are encouraged to look at the other options rather than going for the cheapest option that's going to end up costing the health of their teeth and their gums as well.
Are you able to straighten teeth with veneers?
Yes, you can in certain circumstances. So with kind of mild crowding, if the teeth are mildly out of line, you can improve that with veneers. If certain teeth are set back, you can build them out with veneers, or if certain teeth are slightly further out, you can bring them back into line by just preparing the teeth a certain amount to get them all into certain alignment. Not in every case. If your teeth are quite out of line or quite crowded, then you're most likely need orthodontics first. So kind of mild to severe crowding will need that. But in a lot of circumstances, you can with veneers or with composite bonding as well.
Really?
Yeah. So you can build the teeth out. Now, if the teeth are too far out to start off with, you can't really do composite bonding on that because you have to add a layer onto the front, so it's just going to look further out. With veneers, you can, because you can bring the tooth back a little bit when you're preparing it for the veneer anyway. So it does work in kind of milder crowding cases, yeah.
Interesting, because I know for composite bonding, like a lot of the time, you kind of have to have them straightened before you can really do it.
You can do a certain amount. Like if the teeth could be crowded and they could be kind of inclined in the way, and that way you can build it out with bonding or with veneers. And in that case, if you're doing veneers, you actually don't really need to do much preparation of the teeth because you're just adding on. But yeah, you can for either, but it depends on the case. A lot of the time, orthodontics are better to do beforehand. You know, it gives a more predictable result, but also if you were preparing for veneers, you need to do less kind of taking away of the surface of the tooth for the veneer if you align the teeth first. But in milder cases, you know, it might not be worth all those steps for the amount of benefit that you're going to get. And some people, I suppose, just want to do orthodontics for whatever reason. You know, and you may be able to do it in those cases, yeah.
Yeah. Oh my God, wild.
Yeah.
Wild times. Yeah, no, because I kind of like, what I would think, like if the teeth are kind of sitting on each other with composite anyway, you can't really like get around and paint it if like, you know, as a tooth sitting on top of another tooth.
Yeah, you can't really. And there are some ways of disguising that. You can bring it out at different angles, or if there's more space behind the tooth, you know, you can bring the tooth out into a further position with bonding, but only in mild cases. Yeah. It's trickier definitely with bonding than with porcelain veneers, because if with the veneers you can prepare the teeth, you know, you can kind of slightly take away where they're crossed over, let's say, and then you can put the porcelain veneer into the right position. But yeah, no, it's another option.
Yeah.
Yeah.
My God, love this. Why did I get Invisalign?
Yeah. Why do you plan to get bonding after?
I'm thinking about it. I do have a couple chips kind of in my front two teeth.
Yeah.
And
Well, just a little bit like that, because the shape in that is quite nice. I don't think you're not going to need full constant.
I don't think I'm thinking like full whack.
No. Yeah, if it's just little like imperfections, you probably like, because the shape is quite nice as they are, wouldn't you?
Oh my God. Yeah, no, I definitely don't want like.
Yeah, no, you don't want them kind
straight.
of all straight
Like
across.
sort of a little bit of character.
Yeah.
You know?
It's way more natural. Yeah.
But it's typical. It's always your front tooth that has a chip in it. It's never back tooth.
No. When it's from
right at the
getting
front.
off the glass, or what, you know, or from like sports injuries or sports.
It was because I just did my Spanish oral exam in my leaving cert. It went really well.
Yeah.
And I was so excited that I ran back to school to tell my Spanish teacher how well it went. And I fell and I hit my face off a wall.
That's what they get for the accelerating. It's cocky with your result.
And I came into him and I was like, Senor, it went really well. And I chunked my tooth missing. He was like,
Oh, so is there a big piece?
well, I had it kind of like filled. I don't think it's composite bonding. I had it like kind of filled, but it's still like a bit of it came out and a bit of it is still in there. So
Yeah.
Kind of,
And
but yeah.
you do that at the end.
Yeah. But yeah, so that's, I was knocked down a bed.
That's right. Yeah. That's, yeah.
The universe was like, you're so happy.
Yeah, no.
Let's chip your tooth.
Yeah. You've got more exams to do. Settle down.
So I think you're a very talented cosmetic dentist. How do you think you've got like to your peak?
So like I was always interested in art and drawing, and that I had a kind of an eye for detail maybe already, but I've done a postgrad. I did a 2-year postgrad in advanced aesthetic and restorative dentistry in the University of Portsmouth. So that's kind of, so it kind of, you know, because I kind of picked the area that I was most interested in, but that's, you know, opened up a whole world for me really. It's kind of taught me how to kind of plan things out, you know, rather than kind of jumping head first in, how to kind of plan. I keep things kind of minimally invasive and just kind of fine tune that kind of, I suppose, eye for detail.
What's the difference between Truly's standard ceramic veneers and the premium ceramic veneers?
The standard veneer is milled from one block of ceramic. So we carve it into the shape that we want and we add staining on top of it. So it looks really well, but it's not as natural looking as premium veneers. So premium veneers is where we get a ceramist to back the veneer piece by piece to get every sort of detail that you can in the tooth. Because teeth have certain characteristics. There's more colour towards the top and then they're more translucent at the edge, and you can get those fine details with the premium veneers. It's for someone, I suppose, that like is really paying attention to detail and wants to look in the mirror and wants them to look absolutely like natural teeth. They're the best type of veneer to get. They cost more because there's a lot more detail that has to go into the work to make those type of veneer. The other advantage of those actually as well is they can be made in thinner pieces, so you have to prepare the tooth less for that type of veneer.
And what's the cost difference between?
Premium veneer is $950 and the Emax is the name of the other kind of ceramic veneer is $500.
How would a 3D printed crown be different from a normal crown?
So from the final crown, 3D printed crown is usually made from like a resin or acrylic, and it's not as hard wearing as the final crown basically. So it can kind of, I suppose, wear down a bit quicker, and it wouldn't have the same kind of detail, I suppose, as your final crown. You'd have a lot more kind of colours and anatomical details that you can put in the final crown. I mean, you can, I suppose, put them in the temporaries as well, but they're only for a short period of time, so you wouldn't necessarily need all that kind of detail. So it's the material basically that's different, and that's because they're not needed to last as long as your final crown, which is kind of harder wearing.
Thanks so much for watching, guys. Feel free to subscribe if you'd like to see more videos like this, and we'll see you next time.